Acute aortic dissection in pregnant women. Acute aortic dissection is a condition where there is a tear in the wall of the aorta which carries blood out of the heart. There are two types of aortic dissection, type A, which originates in ascending aorta, and type B, which originates in descending aorta. This is a life-threatening condition for both the mother and the fetus. There are genetical and anatomical predispositions for the condition such as Marfan syndrome, Turner syndrome, and bicuspid aorta. The report to be discussed is a literature review, Outcomes in Pregnant Women with Acute Aortic Dissection, a review of the literature from 2003 to 2013. The key question of this research article is, what maternal and fetal outcome did acute aortic dissection have during pregnancy? In regards to method, the first step was to identify publications related to acute aortic dissection in pregnancy from January 2003 to June 2013. For the next step, the terms pregnancy or postpartum or antepartum and aortic dissection or genetic disorder or aortic aneurysm was acquired in PubMed. In the third step, isolated case reports, small case series, and population-based studies were included in the analysis if they met a particular criteria. There were a total of 59 articles that matched this criteria. They had data on presence of genetic condition, maternal age, mode of delivery, gestational age aortic dissection, and history of hypertension. The results showed that most of the dissections occurred in the third trimester of pregnancy at a median gestational age of 32 weeks. In general, type A dissections were more common at 77.3% than type B dissections at 22.9%. 49.3% of patients were known to have a predisposing factor for acute aortic dissection. Marfan syndrome accounted for 41% of acute aortic dissections. Maternal mortality rate was 21% in type A and 23% in type B. Fetal mortality rate was 10.3% in type A and 35% in type B. Fetal mortality rate was lower in patients who underwent combined cesarean delivery with aortic repair. Pregnancy is a risk factor for acute aortic dissection, especially in women with predisposing factors. A limitation of this literature review is a small sample size of only 59 articles. Future research in this area should include safer surgical procedures to deliver the fetus as well as repair the aortic tear.